Hello, my name is Dr. Hillel Mazansky, and I specialize in medical hypnosis, guided visualization, nutrition, and exercise. My website being www.GIANINC.com, Guided Imagery and Nutrition Incorporated.com, and on Facebook.com/guided imagery. This and all my other YouTube video health tips are placed so that people can read them. If I had to ask the average person, do you think that hypnosis or guided imagery could help skin conditions, they would say no. Well, they're incorrect. Today we are going to discuss certain skin conditions that can be chronic and reoccurring, and where medical hypnosis and guided imagery can help. The first is so-called psoriasis. It is a chronic, red, recurring rash with scaling type skin. It occurs mainly behind the legs and behind the arms, the scalp, occasionally on the abdomen and thighs. The issue with psoriasis is that stress can initiate the disease. The disease is called an autoimmune disease, where the body reacts to itself using antibodies and antigens, and then the reaction takes place where the body actually attacks itself, and that's called an autoimmune disease. But people with psoriasis have a background of stress that could have turned the gene on for the psoriasis. But especially in the females, because it's so unsightly, they don't like to go out into public. They cover their bodies up because they feel ashamed or compromised. And in those cases, medical hypnosis and guided imagery for psoriasis works extremely well in that it decreases the episodes, and once the skin clears, the people feel relieved because they don't feel that stress with regard to having the illness. The next condition is herpes zoster or shingles. We do not use the hypnosis for the actual shingles. It usually begins with pain in the area that's going to be affected, and can be rather intense pain, and then the rash develops. But where hypnosis comes in is that sometimes people can have herpetic neuralgia. In other words, the rash is long gone, but they still have the pain over the nerve area where the shingles appeared. Although shingles is a disease, it's as if it's on the skin. Shingles is actually a disease of the nerve. It is the same virus, the herpes virus, that causes chickenpox when you were younger. When a person was younger, the chickenpox virus flares up and can give the shingles virus. And it turns into the shingles virus, giving a person shingles. So hypnosis can definitely help with a post-herpetic nerve pain. And sometimes the pain can be very strong and powerful, as whenever one stimulates a nerve, one knows how strong the pain can be. So with psoriasis, we assist patients in treating their skin rashes using the psyche or the psychology, the brain. We use it for chronic pain following herpes zoster. Now, the third one is also of the herpes type, but it's called cold sores. And those cold sores break out in little blisters, as those who've had it know, and it can be very painful. That is also associated with stress. The less stress the patient has, the less chance they have of a breakout. As soon as stress emanates its head, then the shingles can appear. So, no, I mean, not the shingles, excuse me, I mean the cold sores. So cold sores related with stress, herpes zoster, post-herpetic pain, and psoriasis to assist in treatment of the psyche, that they don't have a flare-up, and if they are, feel psychologically compromised to go out and be seen in public or go to the beach. You will notice that if one does, if one hypnotizes them and does guided imagery on them, there tends to be a marked improvement. My name is Dr. Hillel Mazansky, and I thank you for listening to this YouTube video for serious skin conditions. Thank you.